Welcome to Get Fitness Success, where we learn about our body, mind, and spirit. This video does not replace expert medical advice. Ask a doctor if you have any questions. Please subscribe, like, and comment. I appreciate your support. In this video, we will learn everything you need to know about rheumatoid arthritis, including symptoms, cause, treatment, and suggestions. Let's begin. Rheumatoid arthritis is a type of arthritis that affects the joints. Rheumatoid arthritis is an autoimmune illness that causes pain, inflammation, and damage to joints all over the body. The damage caused by RA to the joints normally occurs on both sides of the body. So, if a joint in one of your arms or legs is afflicted, the identical joint in the other arm or leg is likely to be impacted as well. This is one method doctors distinguish RA from other types of arthritis, such as osteoarthritis. Treatments work best when RA is detected early, so learning the symptoms is crucial. Here are the symptoms of rheumatoid arthritis. RA is a long-term condition that causes inflammation and pain in the joints during flares or exacerbations. These symptoms and indications become more prominent. On the other hand, periods of remission are when symptoms may entirely cease. RA symptoms most typically affect the hands, wrists, and knees, but it can also affect other tissues and organs in the body, including the lungs, heart, and eyes. Among the signs and symptoms are more than one joint hurts or aches, stiffness in many joints. More than one joint has discomfort and swelling. Both sides of the body have the same joint symptoms, deformities and loss of joint function, fatigue, mild fever, a decrease in appetite, weakness. The severity of the symptoms might range from minor to severe, even though your symptoms come and go. It's critical not to dismiss them. Knowing the early signs of RA will help you and your doctor treat and manage it more effectively. Here are the causes and risk factors. Rheumatoid arthritis is caused by a combination of hereditary and environmental factors that can raise your risk of having it. RA is an autoimmune condition in which your immune system attacks healthy tissues in your body. The exact causes or triggers of RA, on the other hand, are unknown. As part of the illness process, your immune system delivers antibodies to the lining of your joints if you have RA. These antibodies assault the tissues that line your joints, causing synovial cells to divide and lead to inflammation. Chemicals are generated during this process, which can harm adjacent bones, cartilage, tendons, and ligaments. If RA is not treated, the joint will deteriorate and lose its shape and alignment, eventually leading to its destruction. Risk factors include age. The onset of RA is the most severe. Adults in their 50s, the risk of being assigned male at birth increases with age. RA is more common in women who were assigned female at birth and are in their childbearing years. Sex. People born female are 2 to 3 times more likely to acquire RA than those born male. Genetics. People with specific genes, known as HLA class II genotypes, have a higher risk of developing RA. When people with these genes are obese or exposed to environmental stressors like smoking, they are more likely to develop RA. Another risk factor includes the number of live births given. Those who have given birth are at a higher risk of having RA than those who have not. Early life exposure is important. The Centers for Disease Control and Prevention state that, like adults, children whose mothers smoked have a 2-fold increased risk of acquiring RA. Smoking. According to studies, people who smoke cigarettes have a higher risk of acquiring RA. Obesity. Obesity can raise your chances of acquiring RA. Diet. High sodium, sugar, red meat, and iron consumption have all been linked to an increased risk of getting RA. How is someone diagnosed with rheumatoid arthritis? It can take a long time to diagnose RA, and it may require several lab tests to corroborate clinical examination findings. To diagnose RA, your doctor will utilize a variety of methods. They'll begin by inquiring about your symptoms and medical history. They'll also give your joints a thorough examination. This will include the following: check for swelling and redness, assessing the range of motion and joint function, checking for warmth and tenderness in the afflicted joints, looking for nodules on the skin. You'll be putting your reflexes and muscle strength to the test. If they suspect you have RA, they'll most likely recommend you to a rheumatologist, because no one test can confirm a diagnosis of RA. Your doctor or rheumatologist may utilize a combination of tests to confirm the diagnosis. They may search for particular molecules in your blood, such as antibodies, or examine the level of others, such as acute phase reactants that are increased during inflammatory states. These can be symptoms of RA and aid in the diagnosis. They may also order imaging tests such as an ultrasound, X-ray, or magnetic resonance imaging Tests reveal whether or if a joint injury has occurred and the severity of the damage. For some persons with RA, a full assessment and surveillance of other organ systems may be recommended as well. Your healthcare physician or rheumatologist can use a variety of blood tests to assess whether you have RA. Although there is no cure for RA, effective medicines can help you manage the disease and avoid damage. Rheumatoid arthritis can necessitate adjustments on the part of both patients and clinicians as they work out the best strategies to manage symptoms and halt the disease's progression. Recent advancements in treatment tactics have resulted in ever-improving rheumatoid arthritis results and quality of life. Rheumatologists adopt the treat-to-target therapeutic strategy to effectively manage this condition. The treat-to-target approach has resulted in fewer symptoms and higher remission rates for patients with RA. The treatment plan includes the following steps: establishing a specific testing target that indicates remission or a low disease state, measuring acute phase reactants, and assessing treatment and management plan progress on a monthly basis. If no progress is made, change your prescription regimen as soon as possible. Treatments for RA help to regulate the inflammatory response and manage the pain. This can lead to remission in many circumstances. Inflammation can be reduced to help avoid further joint and organ damage. Treatment options include medications, home cures or alternative therapies, dietary modifications, and a variety of exercises. Your healthcare professional will collaborate with you to identify the most effective treatment plan for your specific medical need. Many patients benefit from these therapies because they allow them to maintain an active lifestyle while reducing the risk of long-term problems. There are a variety of medications available to treat RA. Some of these drugs can help with RA pain and inflammation. Others aid in reducing flare-ups and limiting the joint damage caused by RA during RA flares. The following over-the-counter drugs can help relieve pain and inflammation: NSAIDs, nonsteroidal anti-inflammatory medicines, corticosteroids. Acetaminophen is a pain reliever that reduces pain but not inflammation. Anti-rheumatic medications that treat rheumatoid arthritis called DMARDs. DMARDs function by inhibiting the immune system's reaction. This aids in the slowing of RA's progression, instead of suppressing your body's total immune system reaction. New biologic DMARDs deliver a focused response to inflammation. They effectively treat patients who do not react to more typical DMARDs. Inhibitors of Janus kinase are a newer type of DMARDs that inhibit specific immune responses. When DMARDs and biologic DMARDs don't work, your healthcare professional may prescribe JAK inhibitors to prevent inflammation and stop joint deterioration. Here are a few rheumatoid arthritis home treatments. When living with RA, certain home remedies and lifestyle changes may enhance your quality of life. This involves physical activity, rest, and the use of assistive technology. Low-impact workouts can help you develop your mobility and range of motion in your joints. Exercise can also help strengthen muscles, which can ease joint discomfort. Gentle yoga, which can help you rebuild strength and flexibility, is another option. Get plenty of rest. You may require more rest during flare-ups, while you may require less in remission. Getting enough sleep will aid in the reduction of inflammation, pain, and weariness. Apply heat or cold as needed. Cold compresses or ice packs might assist in relieving inflammation and pain. They may also be useful in the treatment of muscle spasms. Warm showers and hot compresses can be alternated with cold treatments. This may aid in the reduction of stiffness. Consider using assistive technology. Splints and braces, for example, help keep your joints in a resting posture. This may assist in reducing inflammation, but it's vital to avoid frozen joints by taking breaks from using them. Even during flares, canes and crutches can help you maintain mobility. In bathrooms and stairwells, you can add domestic equipment such as grab bars and handrails. An anti-inflammatory diet may be recommended by your healthcare professional or nutritionist to aid with your symptoms. This diet consists of foods that are high in omega-3 fatty acids. Omega-3 fatty acid-rich foods include salmon, tuna, herring, and mackerel are examples of fatty fish. Chia and flax seeds, walnuts, vitamins A, C, and E, and selenium are antioxidants that may help reduce inflammation. Antioxidant-rich foods include blueberries, cranberries, goji berries, and strawberries, dark chocolate, spinach, kidney beans, pecans, artichokes. It's also crucial to eat a lot of fiber. Choose foods that are high in whole grains, fresh veggies, and fresh fruit. Strawberries have a lot of health benefits. Flavonoids-rich foods are great to help the body fight inflammation. They are tofu and miso, berries, green tea, broccoli, and grapes. It's just as important to watch what you don't eat as it is to watch what you do eat. Make sure to stay away from foods that trigger you. Processed carbs and saturated or trans fats, for example. When following an anti-inflammatory diet, Avoiding trigger foods and choosing the correct meals will help you manage your RA. Rheumatoid arthritis comes in a variety of forms. Knowing which type you have will help your doctor determine the best treatment option for you. The following are examples of RA types. Seropositive RA is diagnosed when a blood test for rheumatoid factor or anti-CCP shows a positive result. This suggests your immune system is attacking your joints due to antibodies. Seronegative RA is a condition in which you have a negative RF blood test and a negative anti-CCP blood test but nevertheless have RA symptoms. If you develop antibodies, your diagnosis will be changed to seropositive RA. Idiopathic arthritis in children and adolescents. Rheumatoid arthritis in children and adolescents was originally classified as juvenile rheumatoid arthritis. RA in youngsters under the age of 17 is known as juvenile idiopathic arthritis. The symptoms are similar to those of other types of RA, but they may also include eye inflammation and developmental difficulties. Rheumatoid arthritis with a positive serology. The most frequent kind of RA is seropositive RA. This sort of arthritis may run in families. Seropositive RA symptoms may be more severe than seronegative RA symptoms. Seropositive RA symptoms can include morning stiffness that lasts at least 30 minutes. Multiple joints are swollen and painful. Symmetrical joint swelling and pain. Nodules of rheumatoid arthritis. Fever, fatigue, slimming down. The symptoms of RA aren't necessarily limited to the joints. Inflammation of the eyes, salivary glands, nerves, kidneys, lungs, heart, skin, and blood vessels can occur in persons with seropositive RA. Hands with rheumatoid arthritis. Hand arthritis can begin as a low-level burning sensation that you experience at the end of the day. You may eventually suffer pain that isn't caused by using your hands. Without therapy, this discomfort might become pretty severe. You might also experience swelling, redness, warmth, stiffness. You may see malformations in your hands if the cartilage in your joints goes away. If the cartilage in your hands, fingers, and big joints deteriorates completely, you may experience a grinding sensation. Fluid-filled sacs called synovial cysts develop in the wrists, knees, elbows, ankles, and around the tiny joints of the hands as the condition advances. These cysts aren't without risks, and tendon rupture is a possibility in some situations. You may develop knobby growths in the damaged joints known as bone spurs. Bone spurs can make it difficult to use your hands over time. Your healthcare physician will work with you on exercises to help you maintain movement and function if you have RA in your hands. In combination with other types of treatment, exercises can help reduce inflammation and slow disease development. Your hands and feet may be the most noticeable signs of RA, especially as the disease advances and especially if you don't have a treatment plan in place. Fingers, wrists, knees, ankles, and toes commonly swell. A person with RA may have difficulty walking because of ligament damage and swelling in the feet. If you don't get therapy for RA, your hands and feet may develop serious abnormalities. Deformities of the hands and fingers can cause a curled, claw-like appearance. Your toes can also take on a claw-like appearance, curving upward at times and curling under the ball of your foot at other times. On your feet, you may see ulcers, nodules, bunions, and calluses. Rheumatoid nodules are lumps that can form anywhere on your body where joints are inflamed. They come in a variety of sizes, from extremely little to the size of a walnut or greater, and can be found in clusters. This is how rheumatoid nodules and other apparent RA symptoms arise. Rheumatoid arthritis and osteoarthritis are two different types of arthritis. Like RA, osteoarthritis causes painful and stiff joints that make it difficult to move around. After prolonged activity, people with OA may have joint swelling, but OA does not induce a severe enough inflammatory response to cause redness in the affected joints. OA is not an autoimmune disease like RA. It might develop as a result of trauma or as a result of natural wear and tear of the joints as you age. The majority of people with OA are above the age of 60. It can, however, be noticed in younger adults who overuse a joint, such as tennis players and other athletes, or in those who have suffered a serious injury. Rheumatoid arthritis is an autoimmune illness. Normal wear and tear does not produce the joint deterioration caused by RA. Your body is attacking itself, which causes it. Although rheumatoid arthritis is not a hereditary disease, it does run in some families. This could be the result of environmental factors, hereditary factors, or a combination of the two. If you have a family member who has had RA, speak with your doctor, especially if you are experiencing persistent joint pain, swelling, or stiffness caused by overuse or damage. If you have a family history of RA, you're more likely to have it, and early identification can make a major difference in how effective therapy is. Complications of rheumatoid arthritis. You may be at a higher risk of developing other health problems if you have RA. Medication used to treat RA can also cause difficulties in some persons. Heart illness that develops too soon. People with RA are nearly twice as likely as those without the disease to have heart disease. Obesity and RA patients are the most vulnerable. Coronary artery disease is the leading cause of death among RA patients. Carpal tunnel syndrome is a condition that affects the hands and wrists. Carpal tunnel syndrome is very common in RA patients. It causes soreness, numbness, or tingling in the hands and fingers. It's caused by compression of the median nerve, which runs through the palm of the hand. When your lungs become inflamed, you may develop interstitial lung disease, which is the most common pulmonary symptom of RA. Fibrosis of the lungs or pulmonary fibrosis is a lung disease that produces scarring and rigidity, making breathing difficult. Pleurisy is a painful lung ailment caused by inflammation of the lung lining and is a consequence of RA. Pericarditis is a disorder that produces chest pain due to inflammation of the tissues surrounding the heart. The inflammation in the eyes caused by RA can produce uveitis and scleritis, which cause redness and pain in the eyes. It can also cause Sjogren's syndrome, which is characterized by dry eyes. Vasculitis is an inflammation of the blood vessels that causes them to thicken, weaken, narrow, and scar. It can disrupt blood flow to your body's organs and be life-threatening in severe circumstances. If RA is not managed or treated early on, it can cause permanent joint damage. Joints can become significantly distorted, causing harm to adjacent tendons, bones, and cartilage. In some cases, surgery is required to avoid the loss of joint function. Cervical myelopathy is a condition that affects the nerves in the neck. If you have RA, you're more likely to develop cervical myelopathy. The compression of the spinal cord in the neck causes this disorder. It causes dislocation of joints at the top of the spinal cord, limiting mobility and perhaps resulting in permanent spinal cord injury. Pneumonia. Pneumonia is the most common infection among patients who have RA. Renal failure is the third leading cause of death in RA patients. People with RA are at a higher risk of developing cancer, chronic kidney disease, and glomerulonephritis. Bleeding in the gastrointestinal tract. GI hemorrhage is a disorder in which the upper sections of the digestive tract bleed profusely. It's the most prevalent GI problem among RA patients, and it's linked to nonsteroidal anti-inflammatory medicines. Pancetopenia. Pancetopenia is a condition in which a person's red blood cells, white blood cells, and platelets are insufficient. It causes anemia, leukopenia, and thrombocytopenia, which are all blood illnesses. The severity of anemia and the severity of RA are linked. Lymphoma. People with RA are more likely to acquire cancer. Nodules under the skin. These are skin lesions that are deep in the dermis and subcutaneous layers. They're detected in 30 to 40% of RA patients, and they're linked to more serious disorders. Speak with your medical professional. RA is a chronic condition for which there is presently no cure. However, most patients with RA do not experience consistent symptoms. Instead, individuals experience flare-ups followed by remissions, which are symptom-free periods. The condition progresses differently in each person, and symptoms can range from minor to severe, though symptoms may go away for long periods of time. RA-related joint problems normally worsen over time. That's why getting therapy as soon as possible will help prevent major joint injury. Consult your doctor if you're experiencing any symptoms or have any concerns regarding RA. If you've watched this far, please like and subscribe. Now, go get fit.